Good day, ladies and gentlemen. You are highly welcome to the 4th edition of the Tasila Scientific Electronic Conference. For some of us that are attending for the first time, you are highly welcome. And for some of us that have participated in the past, you are welcome once again as we embark on this exchange of scientific ideas towards our career development and growth. I am Nnakwe Johnpaul, a nurse by profession. I will be speaking on the topic Spinal Tuberculosis in Children Below 5 Years, a cause for global concern. Tuberculosis primarily is an infectious disease of the respiratory system which primarily affects the lungs and is caused by Mycobacterium tuberculosis, which is an acid-fast rod bacilli that grows slowly and is sensitive to heat and ultraviolet light. Tuberculosis is a global burden that affects people from low-income countries where there is poor environmental sanitation, poor personal hygiene, and lack of access to high-quality healthcare services for early diagnosis and treatment. There is a close link between tuberculosis and people living with HIV/AIDS due to immunosuppression. Spinal tuberculosis is an extrapulmonary form of tuberculosis in the sense that it occurs outside the lungs and is also being referred to as Pott's disease. Pott's disease is as old as mankind, as it has been identified in the past in the Egyptian mummies, and also in the monograph or publication of Sir Percival Pott in the year 1779, when he tried to establish some relationship between spinal tuberculosis and immunosuppression. Who are those that are predisposed? Those that are usually predisposed to this condition are usually children below 5 years and the elderly above 65 years of age. The predisposing factors to this condition include diabetes mellitus, malnutrition, immunosuppression as in the case of HIV infection, also substance abuse, renal failure. Pathophysiology. How does this occur? Spinal tuberculosis primarily occurs as a result of primary infection by tuberculosis causing organism Mycobacterium tuberculosis in the lungs. So through circulation, there is tendency for this microorganism to be circulated to various parts of the body, which includes the meninges, the brain, the kidney, and the spine. So when the Mycobacterium tuberculosis gets to the spine through circulation, it localizes and invokes an inflammatory response, and the person affected presents with the following signs and symptoms, which include night sweating, pain, weight loss, cough, which can be productive or unproductive, weakness of body parts, and loss of appetite. Management of this condition. The management can be done following medical management, surgical management, and nursing management. Under the medical management, this can be managed the same way pulmonary tuberculosis is being managed, using pharmacologic approach, in the sense that first-line anti-tuberculosis medications are used, following the guideline of World Health Organization of directly observed treatment short course, in which 4 first-line anti-tuberculosis drugs, isoniazid, rifampicin, ethambutol, and pyrazinamide, are being used for the first 4 months, and in the later 2 months, 2 of the drugs are used, which includes isoniazid and rifampicin. For the baby below 5 years that is affected by this condition, as we all know, taking drugs on daily basis for a long period is not an easy task, and hence the mother or the father or the specific others can be health educated on the need for him or her to employ incentive measures to ensure compliance to this treatment regimen, or else multiple drug resistance can occur. So the mother can adopt incentives like giving snacks after taking of the drugs and ensuring strict compliance. When this medical management fails, or because of multiple drug resistance, second-line anti-tuberculosis drugs can be used, which includes kanamycin and the new other anti-tuberculosis drugs. Now, depending on the stage of presentation, if sufficient harm has been done to the spine, resulting in anterior or lateral displacement of the spine, surgical intervention can be employed for the management of this condition, in which an implant is put in place surgically using plates and screws to immobilize the unstable spine. After that, post-operative management can be carried out in the ward by the nurse, where the baby is being managed. For the nursing management, this is done using the nursing process, which includes assessment, nursing diagnosis, planning, implementation, and evaluation. So under the assessment, the nurse kindly assesses for pain, malnutrition, fear, and anxiety. So under the pain, for the management in the planning, the nurse plans on how to relieve pain and for how to restore the baby back to the normal nutritional status, and also how to allay the anxiety of the mother or the parents of the baby that is affected. So in the management of pain, the baby now will be positioned in proper alignment in the bed to prevent compression of the affected spine and then invoking pain. And also for the malnutrition, dietary management can be planned with the nutritionist with diets high in protein, carbohydrates, and minerals, which will facilitate effective healing. And for the anxiety, to try to health educate and give appropriate information concerning the condition, in which the parents are told of the possible prognosis of the disease condition. Now, when the process is being properly managed very well, some complications in the form of kyphosis, lordosis, and the rest cannot occur. Well, in the management of spinal tuberculosis, because of its shared signs and symptoms with polio, most of the time it leads to misdiagnosis and hence takes a longer time for proper management and treatment. Hence, there is no straightforward treatment for spinal tuberculosis, and is being dependent on the stage of presentation. If there is early diagnosis, a medical approach can be utilized, while in late presentation, where the spine has already been damaged and there is instability of the spine resulting in pulmonary insufficiency, the use of implants can be used to stabilize the affected spine. With this, through the collaborative approach of healthcare professionals, I believe that spinal tuberculosis can be effectively managed and the menace can be curbed in our environment. Also, the need for environmental hygiene should be overemphasized, and personal hygiene and proper nutrition, avoiding overcrowding and ensuring proper ventilation in buildings in order to prevent the cross infection from affected to unaffected individual. Also, among the healthcare providers, practicing universal precaution using standard personal protective equipment and proper hand hygiene and obeying other universal precautions can go a long way to curb this menace within our society. Together we can stop tuberculosis. Tuberculosis is an ill wind that blows no one no good. Together let us safeguard the future of these kids that are affected by tuberculosis, and with proper knowledge, awareness through the mass media and formulation of adequate policies, I strongly believe that spinal tuberculosis can be eradicated and hence securing a healthy generation for our kids. Together we can. I remain yours faithfully, Nurse Johnpaul N. Nnakwe. Thanks for your time. Now can I entertain your questions through your messages? Thank you.